Hi, welcome to Choice Cancer Care at Las Colinas Cancer Center.
Well, Choice Cancer Care is a group of doctors and nurses and physicists and dosimetrists and people coming together to give patients a choice of where they want to go get treated. And we're not Walmart. I mean, we're individuals, we're the corner drugstore, we're out on our own in the world, and we'd like the patients to have a really nice experience and get state-of-the-art care and good attention. Well, there's chemotherapy, surgery, and radiation therapy, and Hippocrates put it very well. He said you can poison it, that's chemotherapy, you can cut it out, that's surgery, or you can burn it, that's radiation therapy. Now, we're not cutting, poisoning, and burning patients today, but it's intricate applications of those modalities learned years and years and years ago that have been refined, progressed, and evolved to the state of the art we have today that can help patients and minimize side effects and improve quality of life for all involved. The big terms we have are benign and malignant. Benign is if there's a tumor, it's just sitting around and doesn't do anything. And malignant means it's got the ability to spread. And then if it has the ability to spread, we think of local or metastasized. When a solid tumor is spread someplace else in the body, we say it's metastasized. If the tumor is still local regional, then the patient's got a much better chance of being cured utilizing surgery, chemotherapy, or radiation therapy. Kathy, this is a chemotherapy infusion area. You can see it's a wide open room. It's very bright, and it's easy access for patients. They come and go for their chemo. It doesn't have to be so bad with chemo anymore either. We've got much better drugs to make the chemotherapy better tolerated, more palatable for people. Our patients come in, they watch TV, they listen to music, we have Wi-Fi, they do the internet, some of them just sleep. And it's very wide open, it's very calm and peaceful here. Our nurses are lovely, they're very nurturing and caring people, and I think it makes a very nice environment for healing. So the patient needs to be staged. Staging is the language the doctors use to figure out how far the malignancy is in its natural course of progression. Once the patient's staged, we figured out most cases are curable, we discuss treatment options. And if the patient would like to come in for beam radiation therapy, we'll get CAT scans and fuse it to an MRI and enter the data on the planning computer and program the linear accelerator how to paint the radiation dose in. Right now, we're in the PET-CT scanner, and this is a big fancy piece of equipment that not only has a typical CAT scanner, but it's called a nuclear medicine PET scanner, and it's fused together. And the reason why this is important, with the PET scan fused on the CAT scan, it shows areas of inflammation where there's increased metabolism. It's very sensitive for finding where cancer is. So the patients, a lot of times, if they're diagnosed with cancer, we'll have a staging PET-CT scan so we can do fine diagnostic work. Or if we're treating them with cancer, we can lay them down on this machine exactly in the same position as they are for radiation therapy planning, and then we get this information and put it in the planning computer to program the linear accelerator to treat the patient. Once we capture the images come into the computerized database, and we have here an image of a normal PET-CT scan. You can see the patient's body is moving around in circles, and there's a little bit of uptake in the brain or in the kidneys and the bladder where the FDG, the dye went, but that's all normal. Here's an abnormal one. You can see all these splotches of the dark mottling area. This patient had widely disseminated disease in soft tissues and in the bones, and the patient's quite ill. Okay, we can also go up and down on the images right here, and you can see this way that there's cancer in the liver here, and here's the lungs, and here in the mediastinum, and it's in the bone. You can see the area where it lights up versus where the other tissues are, where there's no uptake or cancer. So now we can really figure out more thoroughly and precisely where the disease is when the patient presents to us, so we can offer different kind of treatments. What we do is we need to get the information so that we can program the machine, the linear accelerator, to paint the radiation dose in. So patients will come in radiation therapy planning position. We have a fully integrated circuit and setup here with the CAT scan and the PET-CT scan, and a lot of times we'll use an MRI, and we fuse the images. And then we take the images and we digitize in on the images where the target is, the target volume, the cancer-related process, and tissues that really don't benefit by being treated with radiation therapy. Right now we're in the linear accelerator vault, and this is a room enclosed by lead to protect the outside people from radiation getting out. And this is the machine that makes the radiation called a linear accelerator. And it's a radiation making machine, and the beam of radiation is made and comes out through the head of the equipment. This is the cone beam CT scanner that we utilize to check patient positioning for image guidance when the patient's on the table to make sure they're set up properly, in addition to the lasers around the room. We can treat small tumors in somebody's brain. We do treatments for patients with early lung cancer. They come in this room 5 times for 10 minutes each time and beam in the radiation therapy with laser precision and sterilize the lung cancer. They never have to open their chest up. Lung cancer is fairly common and the outcomes have been dreary. And so we have a program where the patient brings in $30 and we just do it on a cash basis with our doctors, and we have a low-dose CAT scan, and then we can quickly get down to brass tacks and see if anything's going on in their lungs or not, and if so, it may lead to more intervention and treatment later on if that's necessary. The linear accelerator, like I've been showing you, it's treatment from far away. It's called teletherapy. Putting seeds or radioactive materials in a patient's body is called brachytherapy. Brachy means close, so close therapy. And so there's a procedure when we put little radioactive pellets in the prostate, and you can do it, and it takes about 45 minutes to an hour, and make a cloud of radiation like that, and it can sterilize the cancer and cure it. It's a different type of treatment than teletherapy, and there's different treatments for different patients, not one size fits all. But I think the patients need to get used to going to the doctors. The ladies are used to going, we got to get the men to go too. And if you go to the family doctor or the lady goes to the gynecologist, these doctors are all trained regarding when you need to get a routine colonoscopy based on age 50, or when to start your mammograms at age 50. So understanding these signs and symptoms, so if something happens, you go in and get looked at. Like your car, if your car's running funny, you take it to the gas station, you take it to the mechanic, have somebody look at that. Well, your body's your biggest asset you got, in addition to your relationships. So, if something's not right, to understand what that means, then go in and see somebody and look for a little help and let the doctors help you.
Thank you for joining us for this special edition of Irving Living. We'll see you next time.